Okay, so this little slide right here, we could use this slide and only this slide to kind of talk about BVD. To me, this kind of gives the picture. So what we're looking at here is the gestation of a cow. So we're going to say about 283 days, right? So what happens with BVD in that cow is what stage does she get exposed to that virus, all right? So, and then if you notice right in the middle, I have kind of a blue line there. And then I have some little dots going off to the left on that line. Okay, so traditionally we've talked about persistently infected cattle happening around anywhere from 45 to 120 days. In biology, nothing's perfect, right? So, but usually your optimum time is around 90 days. But again, we used to use that 45 days. Well, actually some work's been done to show that even cows that are infected at conception sometimes will be persistently infected. Now again, the percentages are lower, but it's still an issue, so that's the reason that I went ahead and put those little dots on down the line, because again, as you're looking at BVD and you're looking at stuff online or other people are talking about BVD, they'll kind of center on this 45 to 120 days. Okay, basically what happens if a cow gets infected at conception, she might just go ahead and carry a calf and I mean, her immune system takes care of it, everything's fine. Many times she's just going to abort, or she's not going to abort, she's just going to basically start over again. That is going to be infertility type syndrome. What will happen happen sometimes, though a small percentage of the time, is that virus will kind of sit there. That calf will go ahead and start to mature in utero. When we get out about 90 days, that virus is still there. Now, this is the whole concept of BVD, is what we call a PI animal. Okay, now I want to make a point right here. PI stands for persistently infected. There's a virus out there that's called parainfluenza 3. And I know this kind of sounds a little ridiculous, but I've had a lot of producers that would come back and they would say, well, I'm not worried about the PI because I'm vaccinating for it. What? Yeah, I use this PI3. Okay, so talking about two different things. Understand we can vaccinate to try to prevent PIs with the BVD vaccine. That's what we're going to talk about. But understand there is not a vaccine for quote unquote PI. Okay. So basically the concept of this is what happens if this animal is exposed to this virus at the right time in utero, which is going to be around 90 days, but again, a lot of variation there, right? Is that animal's immune system is to the point that it does not recognize that virus as being foreign. So basically when that virus attacks that fetus at that time, then that animal thinks that virus is part of it. And it'll be there forever and ever and ever. If that animal lives, that animal is born, that animal's weaned, it will constantly, forever shed that virus, okay? So that goes back to what we was talking about earlier, is these viruses, these bacteria, these protozoa have to be maintained in nature or they'd be dead, right? They've got to go from animal to animal. That's the way BVD is maintained in nature. What percentage of the animals out there are PIs? Very, very low percent, 0.5%. But about 10 to 13, 14% of herds have a PIN. Different concept, right? So we don't have a lot of calves, but we have about, 10% roughly of our herds that are affected that have PI calves in them. This virus is constantly being shed. So what happens is when it gets, a pregnant cow, that virus gets through. Again, she's most likely going to abort. She could have another, make more PI calves. Then again, occasionally, several years ago, back in the 80s even, we was saying, okay, don't worry about PI calves because they die. In other words, when they're born, they can't live very long because they're weak, so they die. So basically, if you pull your real poor doing calves out, then you're going to get rid of your PIs. Well, it sounded real good, it just wasn't correct. Back in the 90s, there was a very, very expensive bull in a bull stud, turned out to be a PI animal. So again, some of these animals can look totally normal and be persistently infected. Now again, as a rule, they tend to be poor doing animals, but it's very important we know you cannot recognize a PI animal necessarily by just looking at him, all right? Now, Again, what happens if this animal gets infected after, say, 120 days? And again, I don't like to get zeroed in on these days, but after the immune system has got the ability to recognize the virus as foreign, then what happens then? This virus is not going to become part of the animal. In other words, the animal is not going to be persistently infected, but this virus has an affinity for the nervous tissue. So what you'll see, a lot of these calves, they're born with their brains brain stems are smaller. So that's one of the issues. Sometimes they have problems with their eyes. They'll have what's called microphthalmia, or little bitty eyes, or a lot of times they'll have cataracts. They'll be blind. So they'll have hypoplasia, or the brain just doesn't develop. The thymus won't develop a lot of times in these calves. Thymus is very important in immune function. So basically these calves that are affected, up until about 6, 7 months, then a lot of times they're born with real issues. Like again, they'll be blind, they'll be kind of dummy calves because again, their brain's development did not develop. They don't know how to nurse, they don't know how to get up, whatever sometimes. Now, what happens after 6 months, after to about 6 months of gestation on to term, if a calf becomes infected there, then it responds just like it was infected out in, after it was born, so it'll build antibodies. And years ago we said, well, that's good, because these animals are born and they're born with protection. Yeah, but what we found out is that these animals that were even infected late in gestation, what happens to them many times is they're poor doing animals. They don't do as well as they go through the stocker process, feeding process, whatever. So we did, the short of this all is we want to try to control BVD. But if you don't understand the concept of BVD, just going out and vaccinating, I hope you can appreciate it's not necessarily going to control the disease. So again, this slide just shows you kind of what happens with a PI animal. If that cow gets infected in utero, some of the things that can happen to her. But one of the things, and again, this is just explaining this slide that I had on the gestation, but one of the outcomes is going to be a persistently infected calf. Okay, so there's that persistently infected calf. That calf will shed virus forever and ever and ever until it dies, and there's nothing you can do to stop it. There's no vaccination, there's no treatment, and there's people always coming up with some remedy for PIs. It's not going to work because that virus, that animal thinks that virus is part of itself, and that's the reason it continues to shed it. Now again, we talked a little while ago about why is it important to understand the cytopathic, non-cytopathic. The only way an animal can become infected in nature and make a PI, it has to be infected with the non-cytopathic virus. That's the one that's most common in nature. Most of our vaccines are cytopathic vaccines. So again, that's kind of important that we understand that the only way a PI is made is with a non-cytopathic virus that affects that calf at about, and again, you got variation, 3 months in gestation. Okay, so some of the bad things that can happen is we got that PI calf out there, right? It can go back and it can infect that cow up in the top left. What's she going to have? She's going to potentially have another PI calf, right? So it's going to mess up next year. The other thing is we can affect the health of our calves. And then if you notice that bottom, going back to the bottom right, we have a bull there, right? If a bull is infected with BVD prepubertal, before he develops, right? Before his reproductive tract really develops, then he can become persistently, his testicles, in other words, this organism will get in the testicles and it'll stay there for a prolonged period of time. The problem is when it's in testicles, the only way you can find that virus is by examining his semen. In other words, doing some diagnostics on the semen. You're not going to find it in the blood. You're not going to find it anywhere else. So again, understanding that with bulls is very important. At least we have a basic understanding of that. Okay? So management for BVD. So quarantine pregnant animals. So if what we talked about so far, if I go to anywhere and I buy a bunch of cows and they're bred, what do I want to do with them when I bring them in? Do I want to bring them in and mix them with my herd? If I'm concerned about BVD, and there's other diseases that will be similar, do we want to just turn these animals out? No. We want to make sure that we get that first calf out and we make sure that there's not an issue with that calf. Okay, kind of interesting, I had a ranch when I was in practice that we did have some issues with BVD. Very, very progressive ranch, really worked hard, went in and pretty much cleaned it up. And there's some testing, we'll talk a little bit about how to find these PIs. But did all this work to clean it up. Guess what, a couple years later, they bought about 200 replacement heifers. And they tested the heifers when they brought them in, right? They did ear notch, and that's the way you test for it. And again, we'll talk about that in a minute. But then they threw them in. When those animals calved, they had PI calves. So about 2 years later, we were back in a mess with BVD. And it was just not understanding that concept. It's kind of like a Trojan horse. That calf's, you can test the cow, you can quarantine the cow or the heifer till the sun comes up. But unless you check that calf that she's carrying, then you still might be in a wreck. Okay, so again, test, that's very important. And again, the best test for rule out persistently infected animals is to take a little piece of skin, a little ear notch is usually what we use. Use a hog ear notcher so you don't have to take a lot of ear. You can send that to the diagnostic lab. And there's two different tests they can run. The easiest test is the antigen capture ELISA. They can also run an IHC, which is basically staining and looking for the amount of antigen, but you can send those off, get a pretty good idea pretty quick. Okay, so if that animal is persistently infected, you need to get it out of that herd. Okay, what are we going to do with that animal? So we're going to take it to the auction market? So what do we say? These animals are persistently infected, they're continually shedding virus. We're just going to sell our problem to somebody else, right? So again, the ethics of this, you have to really think about, what am I going to do with these PI calves? So again, the best thing in a baby calf like that would certainly be euthanasia. What happens a lot of times when we find PI calves and after they weaned, if they're doing pretty good, sometimes we'll group these animals. There's actually people that buy PI calves and they have some isolated pens and yards, and they'll go ahead and feed those calves. They're certainly going to discount them. But again, that's an option. But I would, again, there's no law that says you can't do what you want to with it, but I would really just stress, think about the ethics of taking these animals back to the auction market and then letting somebody else have an issue with them later. Okay. So we talked a little bit about the test. I would recommend the ear notch test. Now, you can test blood also, and that works pretty well, but you have to be very careful. Some people get caught in this trap. If you're checking serum on these calves while they still have immunity from their mother, claustral immunity, then sometimes that test is going to be a false negative. And the reason is because when that virus had to get through that mother to that calf to make a PI, right? So that mother had to respond to that virus, and she's going to build antibodies. She'll pass those antibodies along to the milk. So she's not curing the calf, but there might be enough tie-up with her antibodies against the antigen or the organisms that the calf has that you won't be able to find them in the serum. And that happens more than you would think. People are, they're checking serum and they say, well, we've ruled out BVD, and then lo and behold, they have a PI animal. So the ear notch is probably the best thing. If you're just looking at blood, make sure you use whole blood on those pre-weaned calves. Once the animal's weaned, if it's a mature animal or an animal that hasn't nursed yet, then blood or serum is fine. Okay, and then when should you do the testing? And that's another issue. A lot of people say, well, I'll ear notch them all when I wean them. Well, what did we say a while ago? These baby calves on the mother, right? You've got a bull turn in there to try to get the next calf crop, right? So all you're going to do if you leave those PIs in there is you're going to wind up with more disease next year. Okay, so vaccinate's very important, but is vaccination going to protect every cow? No. And so, usually we think of vaccines, most of these vaccines, and again, you're going to read several papers, and some of them will say, well, our vaccine's 100%. Yeah, one little trial, but they didn't talk about the other 10 trials that it was 90% or 80% or whatever. So everybody's trying to put the best slant on their product. Just understand, nobody's product is perfect, right? So even though we vaccinate, we still need to think about other control measures. Vaccination is just one of the control measures. So how can we control BVD? One of the things is if anything purchased, make sure that we try to maintain those separately until we can get the calves out. Do ear notch those calves at birth. If you're considering controlling BVD, ear notch them as soon as they hit the ground, as soon as it's practical. Okay. And then again, if they're positive, make sure you get them out. The other thing I want to stress a little bit about the test is sometimes you can have an animal that's transiently infected, and we use that term kind of loosely. Transiently infected would be like if you and I had the flu, right? You have the flu, I get around you, I get the flu. You were transiently infected, you pass that on to me. Both of us will more than likely cure the flu. Okay, BVD passes that way once you get through that PI stage. Again, the only time the PI animal, you're going to produce a PI animal is at a certain point in gestation, right? So those transiently infected animals sometimes can have enough virus to trip those tests. So again, if you get animals that are positive, it's good to retest them in about 30 days. If they're persistently infected, they'll still be positive. If they're not, then they'll probably be negative on the second test. So again, if it's a valuable animal or something, there's a question, you certainly want to retest it. If you're just testing animals and you're concerned you have BVD in there, I would probably treat those first animals as PIs. But again, you can't confirm that totally until you retest them.